In the healthcare sector, there is a lot going on with respect to a digital change. Things that going from a paper-led transactions to a lot more digital transactions. And in the last 5 years, the increase with video telehealth has also rapidly evolved in the Indian healthcare sector. I think one of the main things with respect to cashless insurance is the trust and transparency between the players, between the health providers, the insurance payers, and the actual policyholders. The openness and trust will lead to a better engagement across this ecosystem, and that's where we come in. The biggest transformation is going to come from preventive healthcare and continuous care. And this can only be achieved by knowing the customer better, knowing the patient better. So, a digital version of the patient, knowing all their health parameters, was very important in this preventive care. And that is going to be the biggest shift. Actually, IHX is in the forefront of bringing this digital healthcare to the hospitals, and not just the large tertiary care hospitals, but to every provider across the ecosystem in India, whether it's the tertiary care in an urban center or a tier 2, tier 3, tier 4 hospital, to bring them, enable them with technology, affordable, equitable technology into a digital healthcare space. And that is where IHX plays a big part. IHX wants to be the backbone of this digital healthcare across the ecosystem, from providers, payers, and the individual, getting the healthcare and the health records into a digital ecosystem where there is complete transparency and trust across all of these payers. Today's healthcare system has a lot of lag between the actual realization of care versus realization of payment. A truly digital cashless system reduces this gap. So your the time lag between getting a care versus actually getting the economic value of that care being realized should be instantaneous. What we are working on is to make that instantaneous. The cashless ecosystem should not have a time lag associated with it. It has to be instant, and that is where we are working. Having equitable access to healthcare is a necessity, is a birthright. And all of these ecosystem players have to come together to enable this right, to enable access to affordable healthcare, enable access to insurance so that the payers are able to cover it. And for insurance payers to be able to cover it, having a transparency with respect to the health of the individual. The individual also has to be open about the status of their health. The providers must be open to share this information, and the insurers must be open to cover the cost of health care irrespective of the state of their health. So I think all of this requires openness and trust. So which is where we coming back to my first point, where IHX plays a big part is in bringing in this transparency and trust across this ecosystem.